Good afternoon, everybody. And I think as we are running late, I think all of us would make short presentations. So I would like to thank Anita and her team for inviting me here today. So when we discuss about medical tourism, so we need to look at what are the advantages. So one, we know that there is a definite cost advantage. We know that there is availability of all the latest technologies. We have safe medical care, and all of us will totally agree that we have expertise and experience, because I think when I did my medical, every day we used to see about 500 patients a day. And when I did my post-graduation, we used to have almost 60 deliveries a day. And I think though I don't practice obstetrics or gynecology now, and I'm only into reproductive medicine, I think I can still close my eyes and do a section or even deliver a patient at any time. And that is our expertise over here. And we know that Indian hospitality is unmatched, and all of y'all will agree to that. So aim of any treatment today is that it has to be simple, successful, as well as safe. So as we know, you can see these people, they are so scared that at what time they're going to fall down. So when a patient comes to us, it's important that we give them a confidence that whatever we are going to do for the patient, as well as the outcome of the treatment, is going to be the best. And today, the medical practice in India is continuously improving despite a lot of hitches we have in our country, because it has a lot of poor patients, though today the number of middle class and the high class patients is increasing. And even our medical colleges do have good care, and I think I've studied in one of the best medical colleges in the country, and I think we had really good teachers and who have really trained us to such a level that probably we've been successful today as private practitioners. So when we talk about mother and child care, we know that what we look at is obstetrics, and we have a lot of centers who are doing high-risk pregnancy practice. Then we have several gynecological problems, including cancers and other non-oncological diseases. Infertility management, today we know that it's on the rise, the incidence of infertility, endoscopy for infertility, and all the other the other gynecological problems. And most important is the neonatal and child health, which is also advanced in India. So we know that quality is the most important factor that we need to take care of. And it is invisible when it is good, so we don't have any complications, and therefore we really don't think whether what we're doing is right or wrong, and whether the quality is good or not. But definitely it is impossible to ignore when it is poor, where we have higher pregnancy rates, and when it comes to infertility practice, wherein we do not have good results. So basically, quality in India is provided at every level. You go to the hospital, the basic, all the requirements are there. We look at the staffing, and that's the most important thing, the facility as well as the equipments, whatever medications are used, especially in the field of infertility, whatever process is there, the diagnostic as well as the therapeutic procedures, the quality of results, as well as the most important is the client satisfaction. And therefore, the 5 M's, what we need to take into account when you discuss about the quality, is the personnel or the man, the material, the machinery, the manuals, as well as methodology, and therefore SOPs in every hospital, and especially in our infertility practice, is very, very important. And the most important thing is the motivation. It's from the staff, the doctors, as well as even from the patient side, because most of the results in infertility are dependent on the psychological condition of the patient, the positive thinking, as well as they being stress-free. And therefore, we see that quality management is implemented at every stage, when the patient comes to the hospital, when it comes to the doctors who are treating, as well as the equipments which are there in most of the centers. And when it comes to personnel, it's most important that anybody coming for medical tourism should look at the qualification, the training, and also look at the wherever they're working, they are assessed for their competency for continual education, whether they are going for it, as well as they also look at their performance, whether they're giving results or they're not giving results. And most hospitals and ART clinics are certified either by NABH, ICMR, or by other accrediting agencies, and we know that certification is a way to increase the efficiency, safety, as well as quality of our practice. And to certify basically is to guarantee meeting a particular standard, and this certification demands a continuous effort in order to retain the same level of quality, and it is an instrument for constantly improving our performance, and that's the most important thing. Coming to the infertility, we know that it is a great social problem, and it can affect the couple's social life, the emotional status, the marital relationship, the sexual life, the self-esteem, the body image, and it has a very negative impact on the entire system and the social impact. And therefore, basically, failure to conceive results in a lot of stress and anxiety, and therefore, it forms one of the most common treatment which is required, because I think everybody wants to become a mother. And we know that a fertile lifestyle is the most important factor which is affecting fertility, and we know that we have to have a fertile lifestyle, and for this we need to remember 3 E's, that is, eat well, exercise regularly, and enjoy responsibility. So this is going to prevent stress as well as the other factors. The other most important thing what we need to remember is today technology has increased the incidence of infertility, and here we need to look at the electromagnetic radiations, and the most common is the mobile phones what we use, the Wi-Fi system what we use, the laptops we use, as well as the microwave ovens, which can affect fertility as well as they can affect the other systems, and they can also result in increased incidence of cancer. And therefore, if you look at the sperm, it's just thinking whether it has a right signal to enter the cervix, the uterus, and the tubes to reach the ovum for fertilization. And so even for this, we are dependent on the technology. And so we have to remember that there are several factors which can affect the results. And this, when they come to us for treatment, and basically this is the physician, the lab, where we treat the gametes, as well as the embryologist who is going to treat the gametes in the lab. And basically, if you look, the efficiency will not only depend upon the lab, the doctor, and as well as the embryologist, but the most important is the patient profile, because each patient has different problems and each patient needs to be treated separately. So one size fits all does not apply in infertility practice, and therefore you have mushrooming clinics where you have, okay, you just use this one particular protocol and you'll have a pregnancy. It does not work. Every protocol for each patient has to be individualized so that we have an optimum outcome. So quality and safety in the infertile practice is very, very important, and it ensures correct diagnosis and offers appropriate treatment. It has to maintain efficacy of drugs used and offer safety of treatment protocols. Have to maintain a safe environment in the laboratories to optimize the results, and this also includes not only the fresh cycles but also the cryopreservation cycles. We have to maintain our data because it's a question of gametes and the question of DNA, and that also is a very important thing. We have to store these gametes and embryos properly, again, because it belongs to a particular individual, and every IVF clinic, as I said earlier, should have a proper SOP. Coming to the various success rates, we know that the failures are much higher than the successes in any infertility treatment. And if a patient just has an anovulatory problem and we just give her something for ovulation induction, she ovulates, and the chances of pregnancy is only as low as 7 to 8%. There are other methods like intrauterine insemination, and here the success is anywhere between 10 to 18%. And if you are using tablets, it's about 10%. If you are using injections, it's about 18%. And when we talk about the ART procedures like IVF and ICSI, the clinical pregnancy rate may be about 35 to 50%. But when we talk about the live birth rate, that is any live birth which is happening after 34 weeks of gestation, it is anywhere only between 30 to 40%. And when we look at the cost factor in India, how much it's going to cost your patients, so one must remember that it is individualized treatment. So every patient is not going to require all the investigations. Every patient is not going to require advanced treatment. So it is only after we see the patient clinically, the first test what we do is semen analysis, and then the rest of the test for the female partner will depend upon a clinical examination as well as the ultrasound finding. If we look at IUI, the cost in dollars is anywhere between $250 to $700, internationally $700, depending on whether we are using the injections or you're using tablets. And when it comes to IVF cycles, it's anywhere between 3,500 to 4,500 US dollars. So, so we know that though India has a good success rate, and the patient, but one must also remember that the patients may require several cycles, because we have seen that the success rate is very, very lower. And many a times, because the patient has constraint of time, we just move on to ART procedures like IVF and ICSI, when a patient can conceive with simpler procedures, just like ovulation induction with intercourse, as well as with IUI. And the other thing is that if you have failed cycles, the patient has to stay in India for a longer time. And we know that India was a hub for surrogacy until November 2015. And we know that third-party reproduction has given hope to several couples, wherein we can do oocyte donation, sperm donation, embryo donation, as well as surrogacy. But it has a lot of ethical, legal, moral, and social issues. And today, international patients cannot come to India for surrogacy. And there might be certain other problems, especially when it comes to gamete donation, because we may not have donors of the same ethnicity, and that is very, very important. And for surrogacy, no international delegates are allowed, and even those who are overseas citizens of India are not allowed to commission surrogacy after November 2015. Again, transportation of gametes or embryos inside and outside of the country is not allowed. We know that most infertile couples are very stressed, and basically this is because of emotional distress, because they're undergoing the procedure, because they have to take daily injections, they have to undergo the egg aspiration under anesthesia, then the embryo transfer. And the most important is that the success rate is only 30 to 40%, and we've seen that poor prognosis is seen in about 18%, despite 3 to 4 cycles, about 18% of the patients who come to us still will not conceive. And this stress is seen most during the oocyte pickup and the waiting period till the pregnancy test is done. And if it is unsuccessful, the stress increases. But if it is successful, definitely the emotional distress is going to reduce. And we know that this stress is basically because of the treatment itself, it could be because of number of unsuccessful cycles, and it has been seen that the females have more stress than the males. And ART can also lead to identity problems. There could be some religious, spiritual problems, and also social problems. And therefore, psychological counseling forms the most important part. And basically, the distress factors could be either personal, wherein you have an initial pre-existing psychological problem. It could be the infertility itself, and their way of thinking about parenting and the general, they cannot cope up with the stress of infertility. It could be because of poor marital relationship, improvised social network, and then everybody, as you go out, especially in India, as soon as you're married, 6 months, you don't have a kid, you go for any social function, and everybody would ask you, oh, you're not still pregnant, you don't have a kid? So that pressure is also great. And it can also be related to the treatment, because there are a lot of side effects of the medication. Again, we know that the pregnancy rates are low and the miscarriage rates are also higher. And many a times the patient cannot take decision. Sorry, I think it's made in Apple, so it's changed. So basically, you have to have 3 types of counseling. One is the patient-centered. The other one is infertility counseling, and the other is psychotherapy, wherein the patient really has a lot of psychological problem. And if you look, an ideal infertile couple should be able to have good social support, should have knowledge about the different treatments, should have a lot of money, everybody knows, and also should have a foresight and more so stamina, and should be optimistic to have a proper treatment. And for that, we have to have a positive thinking and a healthy living. We have to feel good, we have to think positively, have regular exercise, and also have a good social life and lifestyle modification. And basically, if you look at what we follow in India today is the ART draft bill, where this bill has not been passed in the parliament, and therefore it is not law still, but probably we are hoping that it would be passed in the next year, because first it would be the surrogacy bill which would be passed, and this are still guidelines, and what we follow today is these guidelines, and this is very important for a safe and ethical practice in the ART services, and also preventing the misuse of third-party reproduction, and that is very, very important. I thank you all for a patient hearing, and I would like to invite Dr. Anuradha for her deliberation.